right, we're now live. You can begin whenever you're ready.
Thank you. It is now 11 o'clock, right on the money. So welcome, everybody. Thank you for dialing in and your attendance today. It's our committee PM. We've got a fairly short agenda today. It looks like we've definitely got quorum. I'm looking for any disclosures of pecuniary interest, if there are any. I've not heard of any, so I'm seeing none on the screen, so that's great. We'll move forward. Looking to Dr. Renaday for an update. Sir, it's nice to see you. And whenever you're ready, please take it away.
Good, thank you, Councillor. Can you hear me?
Yes.
Yeah, okay, great. So a very short update today. For anyone who was in both meetings, the numbers that I tell you will be different because we've released our data of today's report in between the two meetings, AM and PM committees. And so as of today's report, we had 16 cases yesterday. So that's different from what I said in the morning, which was that yesterday's report was that we had one case the day before. So you can see that although cases are low, there's tremendous variability still. Sometimes it's one case, sometimes it's 15 or 16, right? Which means that there's still disease circulating in the community. That's really important to remember, but I would say it's circulating at low levels. What you're also seeing is as cases decrease or new cases decrease, you see the recoveries start to pick up because it takes several weeks or a certain period of time for each case to recover and to be declared closed. So yesterday we had 16 new cases, but 18 recoveries, right? So that pattern happens more when you see cases go down, then the other things start to pick up like recoveries. We've had a total of 526 variants of concern to date. Most of them are the B117 variant that was initially identified in the UK. Again, expect more of those things to come and be circulating, and we get reports of them all the time, but primarily remember that it's the same prevention tools that we have against the variants that we do against all of the strains of COVID. We have 2 institutional outbreaks and 2 workplace outbreaks, which are steady, but we do get a case or 2 in those added to those every day. So I would say they're still ongoing, and on the sort of either ongoing or stabilized. In terms of the health system, important for you to know that the health system pressures provincially have eased. They've not completely gone away, but they have eased. Certainly the ICUs across the province are more stable, and what we're seeing is fewer inter-hospital transfers. So we're still, sometimes we still get some, but it's not as much as it was a week or 2 ago. Even across the province, you're seeing a reduction in inter-hospital transfers, which is a good sign. I think the point of this is that this was a very narrowly averted health system crisis, right? That's really what happened. I think what just happened tested our system more than it has been tested in previous waves. And so this test again was one where further complications or worse situation was, I would say, narrowly averted. Our local system, from what I understand, is also okay in terms of its capacity, and like they seem to be managing fine, and they're thinking about delivering some of the former services and that kind of thing. Okay, in terms of vaccines, there's some good news there. Just a quick distraction from the good news, which is I can't remember if the last time I had spoken to you or not, if AstraZeneca had been paused, so I'll just review that quickly. Okay, so if it hadn't been then I need to let you know about that. So the province has made the decision to pause the rollout of the AstraZeneca vaccine in terms of further first doses. With respect to the severe blood clotting side effect that has been occurring in conjunction with that vaccine. Now, originally that risk was described as a 1 in a million risk, then it was described as a 1 in 100,000 risk, and then recent calculations have brought that down to about a 1 in 60,000 risk. Recognize that that's still a very rare risk, and recognize that it's still far rarer than the severe complications that happen from actual COVID disease. But in terms of the relative risk between that and other vaccines, I think looking at that and the availability of other vaccines, they've decided to pause it. What that means is that we have to figure out what does that mean for second doses for people who received AstraZeneca for their first dose, and the province is still actively looking at what to do about that, keeping in mind the amounts that they have, when those amounts might expire, and then also when they project to receive future amounts. So when I have more information from the province about that, I'll share that with this group. But if I can return back to the overall vaccine picture, then, we've administered over 60,000 doses as of, and I think yesterday it was over 61,000 by the end of the day. The vast majority of those have been first doses, so that's over 56,000 first doses. Remember that first doses are still more important than second doses. Not that second doses aren't important, but at the population level, you get the most benefit from your first dose. And so the way to make sure that you control the disease is to give as many people a first dose as possible, then circle back and do some second doses. So we've started to circle back and do some second doses, but that work is going to progress gradually and at a slower rate than the first dose stuff, because the first doses are still very critical to get to the community, right? There's also some important, suggestions that certainly waiting this long has no impact on the immunity that you get from your second dose, and may in fact enhance the immunity beyond just getting it in the window that the company had studied it, which was what we would consider a minimum interval window rather than the interval in which you should receive the vaccine, right? So just some information around that, but we are starting to circle back and do some second doses in a priority order. Primarily, what's going to happen is if you were first in line to get the first dose, you start to become first in line earlier to get the second dose, right? Because we have some that are coming up due, but also some that have been prioritized by virtue of their greater interaction with COVID patients. For example, ICU staff, for example, EMS staff who transport known COVID patients, things like that. We've circled back to those to start offering second doses first, and then we're going to gradually broaden that over time. The second dose picture is really us getting in touch with those people to get them to book, because we need to book them to match the second dose that they had to the first dose that they had in terms of the vaccine type. So there's some complexity around managing the second doses, which we're working through, but you'll see that work build up, but it's not going to build as fast as the first doses are building, because that's still the priority. We're expecting to get, the next week or two is stable in terms of vaccines, but then the 4 weeks in June, we're expecting to get some bumps. So that'll help us out in terms of doing more vaccine delivery, but I think it's going fairly well, I would say. We've also, made the decision. The province opened it up to 18 plus. We've also opened it up in the Point Edward site for now to the 12 plus group, because Pfizer is the only vaccine that's eligible for that group. We think it's really important for families to be able to book together in order to do this, that might increase the uptake, but also we're going to look at ways in which we can get that vaccine out to rural populations for the 12 to 15-year-old population too. We just haven't sorted out how that's going to work and still give us the flexibility to use different vaccines in different clinics. So, but for now, people who are 12 and up can book at the Point Edward Clinic. People who are 18 and up can book at any clinic. And I think that's a good moment that we have now to not have to worry about whether somebody is eligible because they work in a particular sector or have a particular disease, but just, you're now essentially open to booking whoever wants an appointment. But remember, vaccine eligibility is now like this. Vaccine supply is still like this. So that means that when we're able to book appointments, it's a little bit farther out than if the eligibility and the supply were more closely matched. But all in all, I think there's positive news on that front. So I think we talked about cases and outbreaks. We talked about the health system issues, and then the vaccines. I think that's what I had for today.
Okay, thank you for that. Are there any questions from the committee? Councillor Broad?
Yeah, thanks, Chairman White. This isn't a question. This is definitely a good experience that I've never had in 35 years being on municipal council. So many positive results coming back from people that have attended your Point Edward or your Wyoming or Forest site. Never in my life have I heard so many positive things that come back from it. Your staff and volunteers are so friendly, and they help take the edge off a lot of people that have got a bit of a nervous touch to them going in for the vaccine. They are a bit scared of what's going on, and make sure you pass that on, Dr. Renaday, because it's unbelievable. Well, thank you.
I certainly will. Thank you.
I can certainly echo that. Thank you, Councillor Broad. Councillor Stark?
Thank you, Chairman. Doctor, there's been much publicity about long haulers and the, the problems that they're suffering with. How many, or do we have, I presume we have local examples of that, and if so, how prevalent is it?
Thanks, Councillor. So this story about long haulers has been around for a while. It's actually hard to really say what the true prevalence of it is. So the scientific kind of process by which we think through these things is to establish disease criteria. Those are in the process of being established. Then to establish potential treatment options, which you don't have until you establish disease criteria. So right now, there's no really good surveillance mechanism in terms of the health system for understanding what the percentage of people who has, what you might call long hauler or extended symptoms beyond initial infection is. And the other challenge is even if those are identified, just like there aren't really great treatments, there are some treatments for severe COVID disease, but there's no real treatment for mild or moderate COVID disease. Similarly, it becomes a challenge to figure out what the treatments might be for the symptoms that persist, if there are any. So I would say that's probably an ongoing conversation that involves a bunch of sort of patient groups who are saying, this is what we have and can you help to explain it? And then scientific and research agencies that might put in some investment to figure out what are these things and how might we link them back to COVID disease, and then how might we treat them. So it's an ongoing conversation that I don't have a lot of information about, but if there is some, I can keep you posted as credible information comes out around it.
Follow up?
Yes, Doctor, and this may be a question that you don't have an answer to, maybe none of us have an answer to, and that is, if the prevalence of this issue becomes greater, do we form, or does your team become involved with any legal disputes as it relates to disability claims for people that are obviously claiming a disability based upon a new disease? And would your group, you specifically, have any interaction with an insurance company in that regard?
I think the answer to your question was in its preface, which is that it is a question that I don't have an answer to. I think that a lot of these things are going to play out as COVID progresses, and I can't really predict how that's all going to work. I think certainly when I go, if you think back to the scientific process around it, it is hard to establish a claim for a disease that doesn't have strict criteria around how to include or exclude people from diagnosis. So until some of those things are developed, it becomes a challenge to establish whether or not symptoms that someone has are in fact related to long COVID or something else, right? And so there's a diagnostic process that I probably wouldn't be involved in at the individual level.
Thank you.
Thank you. Any other questions from members of the committee? I have one, Dr. Renaday. Is there a projection based on the planned supply uptake that there will be full capacity at all of our sites? Are you looking towards that at this point, and do you know when that date might be?
Thank you, Councillor. I don't know when the date would be, but I can anticipate that in the month of June, as we ramp up on vaccine supply, we'll be able to increase our capacity fairly easily to deliver those vaccines that we get. And so I think that we'll start to see, I would say our clinics are already full, but you'll start to see more of them as we get more vaccines.
Okay, thank you. Councillor Broad?
Yeah, thanks, Councillor White. Just to follow up on Councillor Stark's question there, I guess my question is, the press seems to really pick on the side effects of the vaccine with COVID. And we've gone through numerous other vaccines and things across the number of years. Is there anything different with the COVID one? And I guess what the question is it significantly higher with the COVID vaccine than any other vaccine that we've taken in the past, the side effects, or is it just the press picking up on it and running with it?
Probably a bit of both, Councillor. So, there is a little bit of an increased attention to side effects and things like that because it's a new disease and new vaccines. I would say, though, on the other side of that because it's a new platform, right? These mRNA vaccines and the viral vector vaccines are a slightly different platform. Broadly, I think it's important to have at the population level, sort of broader than we can do here, an analysis of the comparative sort of side effects. But I'll tell you anecdotally what we see is that there are more often you see very mild side effects compared to the incidence of mild side effects that we see in other vaccines. And I don't know how much that has to do with the people's anxiety around the vaccine itself. And so I think that that's probably a matter for further study at a different level. But anecdotally, I can tell you that from our perspective, we are seeing a number of very, very minor reactions to the vaccine, which would be we slightly larger than I would expect for the routine vaccines. And some of it may have to do with the platform. Some of it may have to do with people's sort of initial being worked up about getting them.
Well, thank you very much.
Thank you. Anything further? I'm seeing nothing else. Again, Dr. Renaday, thank you so much for joining us. We appreciate the update, and once again, our sincere gratitude to the whole team, along with yourself, for everything you're doing. And we'll look forward to hearing from you in a couple of weeks.
Of course. Thank you.
Thank you. Okay, committee, moving on to item 4, long-term care division. We have 2 information reports. I'll look for a motion to receive those reports together. Councillor Boucher, Councillor Broad seconds that. Are there any questions or comments? I'm seeing nothing for either. All in favor? That is passed. And that's it so far. Is there any other business? Ms. Joris?
Nothing from me, thank you.
And is there anything from the committee? I see nothing. Okay, thank you. Moving on. Item 5 is Corporate Service Division. There are no reports in that. Do we have any other business for corporate services? I'm seeing nobody chiming in on that. I'll assume the same for the committee, so we'll move on to Finance, Facilities, and Court Services. We have 1 information report. Court Services Q1 Stats and Activity Report. I always feel so fancy when I say Q1. Do we have a motion to receive that report? Councillor Cook, Councillor Ferguson seconds that. Any comments or questions? I see none. All in favor? And that is passed. Is there any other business? Mr. Pilarchio?
I think we're good. Thanks for the support on the report.
Appreciate that. Thank you. And from the committee, I'm seeing nothing. All right, we're going to move on. Going down the slide fast today, kids. Social Services Division, we've got 2 information reports. Housing Services and Service Manager Annual Information Report, Information Return Report. I'll look for a motion to receive. Councillor Broad, Warden Marriott seconds that. Are there any questions? Councillor Ferguson and Councillor Arnold. Councillor Ferguson?
Just a curiosity question. When I look through, I see there's several 4 and 5 bedroom facilities. Do you hook 2 together? Do you have a big house? Just a curiosity question. Thank you.
Thank you. Through you, Chairperson White, to Councillor Ferguson. I'm actually going to call on our Manager of Housing Services, Kelly Hall, to respond to that.
Through you, Chair White, to Councillor Ferguson. The 4 and 5 bedroom units, we have a combination of row townhouse units as well as some semi-detached units that would make up those unit complements.
Thank you.
Okay, thank you. Councillor Arnold, I believe you're next.
Thank you, Chair White. I just had a question in regards to some of the experimental or pilot projects that have been started in regards to the minimum income standard. And I realize that it's not addressed in this, but I'm just wondering what type of a ramification, if that goes forward, will it have on our social housing? When I look at some of the numbers there, I don't know how people can ever survive on those types of amounts of money coming into a household and still pay for a place to live and buy groceries and all the rest, whether you're a single person or have a family. So I'm just wondering if you've seen anything come across your desks in regards to the pilots that had been announced a while ago for the minimum income standard of, and I believe it was around that $20,000 to $25,000 range. And if there is, have they ever said anything about the ramifications to the social housing aspect? And I don't, if you don't have an answer, that's okay. Maybe in a future meeting, we could have an update on that.
Chairperson White to Councillor Arnold. Yeah, at this time, we really don't have a lot of information about that. There was a pilot several years ago that happened in 3 communities within Ontario. That pilot was ended, however, and there wasn't a lot of information. So I think we'd have to take that away and take a look at it and bring back some information at a future time.
That'd be super, Chair White. Thank you.
Thank you. I appreciate that, Ms. Colasanti. And I'll look for any other questions or comments on the reports. I'm seeing none. I'll call the question. All in favor? And that has passed. Is there any other business for Social Services Division? Ms. Colasanti? Seeing none.
Nothing from us at this time. Thank you.
Okay, thank you. And anything from the committee? Seeing none, we'll move on. Thank you so much for the reports. And there is no in-camera report for today, and that leaves only one item, probably the most important of the day. Wait a minute, I thought we had a motion somewhere. Didn't we have a motion? No? Okay, well that's it. This is our motion. Councillor Broad, are you moving to adjourn? Sounds good to me. Councillor Loosely seconds that. All in favor? That's it. It is passed. Thank you, everybody. Look forward to seeing you all at the next County Council meeting, and stay safe. Be well.
Goodbye. Good luck, folks.
Have a good
Bye,
weekend.